Hi, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County. This is our briefing for November 6th, 2020. It's been a week or so since we were together, and a lot has changed since then. I'm in an office all by myself, so I'm going to take my mask down so that those who read lips can see a little bit better about what's going on. Oh my goodness, what a week. Again, but this is a chance for you to ask questions, so please just put them in the chat section, and electronically they'll come to me and we'll be able to do this. In addition, if you think of questions in between times, I would encourage you to put them to send us by email at facebookquestions@douglaspublichealthnetwork.org, and we can get those questions, and when we get those questions, we'll answer them the next time. Wow, what a week. In addition to the election, which was quite the spectacle, this has been the worst week for COVID. Just yesterday, we had the highest number of cases in the world during the entire pandemic. We had the most cases in a single day in the U.S. since the whole pandemic. We had the most cases in Oregon that we've ever had since the pandemic, and we had the most cases in Douglas County. So in the world, we had 611,000 cases, which brought the world count to over 50 million. A really staggering number. The U.S. had 118,000, and now we're over 10 million. So 10 million cases in the U.S., 50 million cases in the world. And in Oregon yesterday, we had 803 cases, so over 800 cases. You remember just a week ago, the last time we talked, we were in the 300, 400, 500 range. Now 800 today, 700 and some odd. 803 yesterday, 700 and some odd today. So 1,500 cases in just 2 days. And in Douglas County, just a staggering number of cases. 15 cases yesterday, and as I was leaving the office, they were just rushing in. So I do not know how many we're going to have today. In the world, it's very active in much of the northern hemisphere, including U.S., France, Italy, UK, but also more equatorial places like India and Brazil are also struggling. What we are noticing is that places in South America, which really struggled over the last few months, are now starting to see a decline in cases, maybe because, I got a message here about my mic. Maybe because the weather in those places in the southern hemisphere is now warming up. It was also yesterday the highest death count ever, so we had 8,700 deaths in the world yesterday, even higher than that initial peak when we had the terrible times in Italy and France. In the U.S., as much as we've had an increase in cases, the death case count has not gone up, but we still had over 1,000 deaths yesterday. We're now at 240,000 deaths, and likely by Thanksgiving, we'll be at 250,000 deaths. Now, 250,000 deaths doesn't sound that much, but if you look at the 1918 flu pandemic, there was a peak in the summertime, cooled down in August and September, then started taking off in October and November. And by the time they got to November 1st, they had about 75,000 deaths in a population of a little over 100 million in the U.S. Well, get to 2020, 102 years later, we had 225,000 deaths in a country of 330 million. So really proportionally the same number of deaths, and the curve that they saw in the fall with the pandemic flu in 1918 is very similar to what we're seeing now. Really staggering rises in the number of cases. In the U.S., it is active pretty much everywhere. There are 35 states with over 1,000 cases, and just a few states in the country that are not having really strong rise. So there's a website that I follow every day called RT Live, and that tells us about the reproductive number. So for every case, how many secondary cases you're going to get 5 days later. It's staggering. All of the states except for one have an RT above 1. Oregon has been 0.95, 0.98, 1.03. We're at 1.21 now, suggesting we're growing at a very quick rate. In Oregon, we're seeing lots of cases. And in fact, you may have heard the governor today say that Multnomah County, Marion County, Jackson County, Umatilla County, and Malheur County are going back. They're closing down. They're decreasing the limits. They're encouraging takeout meals only. They're really decreasing gathering size. And so we are really in a bad stage. And we're in a bad stage now, not only because there's a lot of disease, but hospitalizations, which had not been a big problem just in this last week, have really picked up. And so the highest number of people we had in the hospital with COVID was back in that March, April, May time, where we had about 300 people in the hospital. 322 today. And with that high number of hospitalizations, a real worry that we're going to overload the hospital system. Now, back in the springtime, people were raring to go. You know, this was the new thing they wanted to do. At this point, people are really tired. I mean, there would be people working in these ICUs extra time, overtime for a long time. In addition, many of them are now either sick or family members are sick, and so they're needing to stay home to take care of family members. And hospitals are really having trouble staffing those units. Not just in Oregon, but when you look in Iowa, when you look in the Dakotas, when you look in Texas and in Florida, they're having trouble staffing their ICUs, not because necessarily of physical ICU beds or physical ventilators, but they're sort of running out of people to run that. And the people that take care of you in the ICU are not just people you can hire off the streets. These are extremely talented and well-trained individuals that are always in tight demand. I mean, if you're an ICU nurse, you can probably get a job almost anywhere. But what we're seeing now is during this time, it's getting even harder. When we look in Douglas County, we have 15 cases yesterday, and they're very, very widely spread. And they're very widely spaced. Again, it seems to be mostly gatherings. And in the last week, we've had Halloween parties, polka parties, birthday parties, family reunions, all of these places where people go to the reunion either mildly sick or not sick at all even yet, with the sense that, well, I'm not sick, I can go to this party and I'm not going to spread it to anybody else. But with a lot of cases in the background, one of those people may be sick and then spread it to everyone else. What happens then is that those gatherings spread out. So they told a story today at the governor's press conference that there was a family party, a bunch of people got sick, and then spread to a nursing home. A bunch of people in the nursing home got sick, and then people died. And this is how it spread. So we're really asking people to be very, very careful about gatherings. And we're worried about gatherings because, this is the weekend, there's going to be Ducks games and Beavers games. And, typically you get together in a bar, get together with friends watching these games. And we worry that those are going to be battlegrounds for this disease. We've also had a bunch of school outbreaks. Just as I was leaving another one, I think we have a dozen or so school outbreaks now. Now, these school outbreaks means there's one case in the schools. And in almost all of the cases, it comes from a teacher who's sick and goes to school, or a teacher who's not yet sick and later gets sick and goes to school, or a student. And in each of these cases, these were students who were exposed at home, went to school, and then exposed lots of others. And so there's lots of cases in the community. It's then not surprising that there's going to be a lot of families that have this. They're going to have kids, and those kids are going to go to school. But it's getting to the point where the number of school outbreaks is just so high that it is really, really, really disrupting school. So then there's this question: is the new matrix for schools to stay open was 60 in 2 weeks. We're at 58 now. So the school metrics are a little confusing, but the school metrics now have, you are at a low rate. You can do whatever you want if you're less than 25 cases per 100,000 for 2 weeks. 25 cases per 100,000 for 2 weeks. In Douglas County, that's 27 cases. So we had 27 or less cases, you could open anything. Between 25 and 50, it's a little more open. 50 to 100 more restrictions. 100 to 200 more restrictions still. And at 200, schools need to close. I'll have Vanessa pull the exact numbers over the last 2 weeks, but we're a little over 100. And so we're going to be, I think, between 50 and 100 per 100,000. Still relatively low, but nonetheless, the trajectory is totally wrong. Looking at, really just 6 weeks ago, 5 weeks ago, we were less than 10 cases a week, and then we had 15 cases just yesterday. So the trajectory is truly wrong, and it's hard to know what's going to happen next week. So Melissa says, is there evidence that people can get COVID twice? What does that mean for a vaccine, Melissa asks. And the answer is we don't know. So the good news is that these do not appear to be very, very common, right? So that if it was really common that you got this twice, that would look bad. We do know that you can definitely get it twice. And I think there's good data you can get it twice. In at least 2 of the well-reported cases, people were sicker the second time than they were with the first, which was a worry. We still don't know about how well the vaccines work. We think we have a pretty good idea that the vaccines generate an immune response. We think we have a pretty good situation, a pretty good handle on the fact that people make antibodies. But whether these antibodies are really protective, we just don't know yet. And what they're going to need to do is one of 2 methods. The method we're going to use in the United States is there are people vaccinated, people who are not vaccinated. Every week you're going to find out how many people got the disease. And if nobody in the vaccinated group gets disease and 10 people in the unvaccinated gets disease, and then you bring it out and that gets replicated over time, then the vaccine is 100% effective and you can tell. The problem with that is it takes a little while because you have to see how many people get sick. So for example, if you did this in Douglas County, even at 15 cases per day, let's just say, that means that only about 1.4 people out of 10,000 would get sick in any one day. So it'll take a long time to get 100 cases in that 10,000 group. In England, they're talking about doing what's called a challenge. So you get a bunch of people, you give some the vaccine, some not the vaccine, you expose them to the virus and you see if they get sick. The advantage of that is it can be done much more quickly. The disadvantage is even if you take young, healthy people, some people can get really sick from this. And so there's an ethical issue. Is it ethical to go ahead and expose volunteers to a disease for which there's no treatment? I don't know. I think it's on the borderline. There's a question about mink. So mink, these little weasel-like animals that have the most wonderful fur. And Denmark is sort of the world place for doing mink. I guess they have 17 million mink in Denmark, and it's spreading like wild among the mink farms, and they've decided to cull or kill all of the mink in Denmark to keep this from spreading. So the question is, what does that mean for other animals? Most of us don't have mink as pets, but what does it mean for people who have ferrets as pets or chinchillas as pets or cats as pets? Are we expecting to see lots of spread? We do know that cats can get it, but they don't seem to be quite the good spreaders as are weasels. What is so amazing with viruses, and this I'll do my nerd, I'll be the nerd here. There are viruses that spread from one group of animals to another and weirdly miss people and miss groups in between. So for example, this COVID virus we think were in bats, pangolins, which are these little scaly anteaters, and humans, and now mink. But not so much in dogs or cattle or pork. And then other diseases spread from pork to people. And it's weird because people have really spent a lot of time thinking about this. And there's some that go from that just are humans and whales. I don't know how humans would give it to whales, but it just spreads among different species. So this is a weird one with the mink, and we don't know what this is going to mean. The concern would be if this can now set up groups, then basically what you're going to, groups of animals, what you could do is you could have this carried in the animal population and then keep spreading back to humans. So, we don't have that many weasels in the US, but we do have possums. And the question is, for example, this spread in the possum population didn't make the possums particularly sick, but they could keep giving it back to your cats that can give it to you. That is almost too complicated to believe. In general, however, there's one species which is the most efficient spreader, and in this case it appears to be humans. But I will tell you the mink, weasel, ferret story is clearly going to be looked at carefully. So Janie asks, is there any plan on helping stores such as Walmart, Lowe's, Home Depot enforce face mask covering mandates? These are hard. These are businesses that have customers, and they don't want to be yelling at their customers about anything, right? They don't want to be, and so they're having real worries about that. And I think if you would compliment the stores for what a good job they're doing on it. So the grocery store I work at, or I shop at, they do an incredibly good job of having people wear masks. In fact, I don't ever think I see somebody without a mask. And if somebody doesn't have a mask, they come and say, "Oh, looks like you forgot your mask. Would you please put one on?" And they're very positive about it. And so I think I would go with the positive. Now, in the negative, OSHA will enforce these rules. Again, people don't like to hear from OSHA, but OSHA will enforce those rules. So Sherry says, we're flying to Hawaii at Christmas for my son's wedding. The COVID testing is required 72 hours before arrivals is confusing. Does insurance cover it? Where do we get it? Start at the beginning here. Really? Do we really want to be doing a travel wedding in December? I mean, if anything I know is true, it's bad now and it's going to be worse in December. And the travel to get there and whatever is very, very worrisome. And again, weddings have been one of our biggest source of outbreaks. I mean, I love weddings. You go to weddings, you see all these people you haven't seen in a long time. You tend to get close. No matter how you do it, you're going to have exposure. So I think first, I would really question about whether you want to do a wedding in Hawaii. If the decision is we got to do it, we're going to do it. What about COVID testing? So I checked out Hawaii's program. So Hawaii does have a testing, 3 ways to do it. You can go there and quarantine for 2 weeks. That's the safest. However, you have to quarantine in your room for 2 weeks. That's not particularly great. You can get tested at the airport before you go if you're leaving from San Francisco or Seattle. It's $150 and not covered by insurance. And you get the results back overnight. It is really hard to get it here in town because typically Hawaii is requiring a PCR test, not a rapid antigen test. The PCR tests are not done locally in Douglas County. They're all sent out. And because they're sent out, the turnaround time is unclear. What you wouldn't want to do, I think, is to get the test and then not have the result and miss your flight, or get the test and have a false positive, which could happen with the antigen tests, and then miss the wedding. Does insurance cover it? May or may not. So insurance covers diagnostic testing. So if they think you're sick, or if you're a contact of a case, they will cover that. It is totally unclear if insurance is going to cover a test for travel. And again, typically they can run anywhere from $100 to $200. There's no place in town to get those pre-travel tests. You can check with other places, but again, typically they prioritize sick people first. And since they prioritize sick people first, it's sometimes hard to get these tests. But again, I really wonder about doing a wedding at Christmas in this environment. Okay, let me go through some things. And Vanessa, if you could tell me how many cases we've had over the last 2 weeks, that would be great. It was up there and then it went away. So a couple other things that we have along the way. The mink story is a fascinating story because this suggested that other species could be involved, which could make this much more difficult. In terms of new therapeutics, there's really nothing new in the last week. The remdesivir studies are now finalized. It seems to have a mild effect on viral load and a mild effect on length of stay, but not much effect on hospitalization. The good news is more remdesivir now, and remdesivir is being more widely used. Convalescent plasma, which seemed like it should work, that is, you take the blood from people who've had the disease, you take the antibodies and you give it to people with the disease. I thought that could actually really help. That has shown to be very safe, but it's been disappointing in the results, and really it's not that effective. The third is the is the monoclonal or polyclonal antibodies. Not much new. I know the president got it, but there's been very, very, very little new about polyclonal antibodies since. One of the companies that was doing this actually had to stop their trial because of side effects. So we really don't know much more about that. Decadron, very effective, and so we're recommending anybody who's in that serious phase get Decadron because it does seem to do that. So we've had 94 cases over the last 2 weeks. Now, that's over the last 2 weeks, Friday to Friday. Sunday to Sunday is going to be a little different. We have changes in school, and we need to start going back when we have 100 cases per 100,000 people. Since we have 112,000 people in the county, it's 112 cases. So we're just slightly underneath that. But the trajectory of cases over the last 2 weeks has really been bad. So I think likely we are going to not need to make changes in school this Monday, but who knows about next Monday. Other things, I always follow the doppelganger counties. So remember, months ago, back in August, when the disease was very low, I looked at the disease in 4 similar counties around the country. So there's Douglas County of between 100 and 125,000 people, not a big urban area, other than being very beautiful, nothing special about it, on an interstate, small community college, with a mix of manufacturing, retirement, and other kinds of things. And then I tried to find 3 other counties in the country that had different approaches to COVID in different parts. So we picked Lowndes County, which is the county where Valdosta, Georgia is. We picked Twin Falls County in Idaho and Pennington County in South Dakota, which is where Rapid City is. And what we've found since then is there's a really big difference. So, we're struggling now at 8 cases a day. Pennington County is having 114 cases a day. Twin Falls, 85 cases per day. I talk about us having 94 cases over 2 weeks. They're having 85 cases a day. Lowndes County is having 21 cases a day. And again, with deaths, we're at 10 deaths, which is still 10 too many. But Lowndes at 119 deaths, Twin Falls at 53 deaths, and Pennington at 50 deaths. Now, Douglas County, all the counties were a little different. Douglas County was far and away the oldest county. And even being the oldest county, we have far and away the lowest death rate. Interestingly, I looked at the politics. The politics are all very interesting. Trump won every one of the counties. Between 55 and 67% of the vote, and Mr. Biden got no more than 43% of the vote. So they're all otherwise similar counties, but really a big difference in how it worked. So Debbie says, I've attended bingo weekly. Oh, darn it. An area that's large enough to wear masks. Is that a risk? Well, I think bingo is a big risk. And bingo is a risk for lots of reasons. One is the people who play bingo tend to be a bit older. The second is talking and laughing and whatever is part of what makes bingo fun. Social distancing is certainly great. Wearing masks is certainly great. But it tends to be a time where you're together for a long period of time. And so that is a moderate risk activity. I'll just have to tell you, it's a moderate risk activity. So if I had a 5th grader, would I be comfortable sending them to school right now? The answer is yes. If I had a 5th grader and they were doing everything right at school, the risk to the 5th grader is very low. I mean, again, we've not seen any spread in schools. The risk would be far higher that he would get it home and bring it to school than he would get it at school and bring it home. So I would certainly feel comfortable about sending a 5th grader to school. On the other hand, I know there are others that aren't comfortable. And I think we really have to be sensitive to other people's needs and desires, because other people may have a different risk tolerance than I do. I mean, obviously the person who's going to bingo has a pretty high risk tolerance. Other people, for example, if they're really quite sick or have an elderly grandparent at home, may have a very much lower risk tolerance. And I think we have to accommodate people on various levels of risk tolerance. So Jerry says, what about high doses of vitamin C and D3? Well, there's no data that high doses of vitamin D3 or high dose of vitamin C make a difference with COVID. Now, there is some data that people who get really sick with COVID tend to have lower levels of vitamin D than people who get less sick with COVID. But with all of the vitamin D studies, it's a little hard to know. So vitamin D is a vitamin which you can take either orally as a pill, you can get it in foods, milk is fortified with it, or your body can make vitamin D from being in the sunlight. So if you look at surfers, they always have great levels of vitamin D, right? Because they're out in the sun, or marathon runners, because they're out in the sun getting lots of sunshine, and they get a lot of vitamin D. If you look at people who are wheelchair bound and can't get out of the house easily, they almost always have low levels of vitamin D. And if you looked at the group of people who would be most likely to get really sick with COVID, it wouldn't be the surfers and the marathoners, it would be the people who were at home. And whether they're getting sicker because they have low levels of vitamin D or because they're not outside as much and not as active, we just don't know. Vitamin D has been attributed to lots and lots of different conditions. And so then they've done studies where they give people vitamin D and see if it makes it better. Asthma, osteoporosis, cancers, and it's never been shown to make a difference giving you vitamin D. On the other hand, we don't think that that therapeutic doses of vitamin D or vitamin C or any of the vitamins are dangerous. So if you want to take a vitamin, go for it. Is it going to make a big difference? Probably a lot less than wearing a mask, social distancing, and staying home when you're sick. Okay, so send in the questions here and we'll get going here. A couple other things that came out here. One more is about the Binax tests. So these Binax tests are really now widely distributed. Over 20 clinics in the county have these. They've turned out to be really quite efficient. They've really been quite effective, and so we really like them. We do not think we've had any false positives. We don't know about false negatives. We don't think we've had any false positives, so that is great. So Janet says that if you have several health issues, is it okay to go out shopping yet? So we have a little risk stratification thing, which we're going to talk about a little bit later, about what are the high-risk activities, what are the low-risk activities. And so this will be a good time to do. Let me see if I can find it here, and then we'll do it. So the governor today found 5 counties that were struggling in Oregon and put mandatory restrictions in those areas. Anybody who's been listening to me for a while, I always so much prefer doing things on a voluntary basis rather than doing things on a mandatory basis. I think when you get mandatory basis, you get a lot of people arguing with each other. I think when you do it on a voluntary basis, it's typically more cheerful and you can get more people involved. So what I said is we've seen a stunning increase in the number of COVID cases and deaths in the past week. Now this surge throughout Douglas County and throughout Oregon puts our continued school opening at risk and exposes our most vulnerable seniors to death and disease. And indeed, we've seen this, right? So we've seen more deaths in this last week, more cases. Now, most of the spread in Douglas County has not come from low-risk activities, but has come from moderate or high-risk activities. And if we can decrease the spread even a little bit, so just get back down to the time we were having 5 cases a day, our schools can stay open, and we can certainly protect our seniors. So I know we are all so tired of COVID. But there are things we can do that could either slow the spread or even stop the spread of COVID. And so what we came up with, we have great people in our office, we came up with a challenge. People do this funny like ice bucket challenge where they put ice water over your head, or like the No Shave November, which people do. And people find them to be kind of fun. I mean, I don't think anybody wants water dumped on their head, yet they do it kind of fun, and it's just short. Right? No Shave November, it doesn't mean you'll never shave again. It means that you won't shave for November. And then people otherwise have done a 2-week diet challenge, and I won't eat any meat for 2 weeks. Those of us who are Catholics have done Lent, where for 6 weeks you give up something. And you can almost always do that for a few weeks. So our challenge is we want to cut the COVID risk so our kids can stay at school. Cut COVID risk so kids can stay at school. And so there's 4 things in here. So the first thing is we want people to do more of some things. So we want people to do more of the things that increase the sense of resiliency, the sense of our community working together. So we're asking that people call or video chat with someone who can't leave their home. So you may have an older relative or somebody else who really can't safely leave their home. Boy, it would be great to call or video chat with them. Second is to thank a nurse or a nursing assistant. The nurses or nursing assistants have really worked really hard, especially in the nursing homes. And so if you know somebody who works at a nursing home, give them this. The third would be to shop at our local businesses. I will tell you, if we have to do another shutdown or a contraction, that's going to be really, really hard on the mom and pop business. It's going to be hard on all the businesses, but it's going to be especially hard on the local businesses. And then we want people to do more of things, wear face covers, wash your hands, distancing, all those kind of things. So do more of those things. We think there are some low-risk activities that we want people to continue to do. Gatherings with your own household, dinner with the family, do it. Walks, bike rides, car rides in our beautiful county, do it. Again, a walk by yourself in Stewart Park, a bike ride out in Umpqua, a car trip out to the coast. Those are all really safe activities. You're going to stay in your car. Those are safe, and you should continue to do those. Getting takeout, we think, is also really quite safe. Working from home, we think, is quite safe, and we should continue to do those. And visiting one of our parks. We've got great places around in our county that we should do. So we really want people not to just sit at home and watch TV all the time. We really want people to still gather with family. We want people still to go to our local restaurants. This is where, in this group, is where shopping at a store wearing a mask fits in. Again, when we have looked at places, grocery stores being such large areas that typically have great air handling. And the reason they have, a friend of mine worked there, and said the reason they have such great air handling is nobody likes a smelly grocery store. So when you think of it, they get the meat counter and the fish counter there. You usually can't smell that stuff because they have really good air handling. So grocery stores, we think, are relatively safe, and we don't think there have been any outbreaks among shoppers at grocery stores. Now, there have been outbreaks among workers at stores, but not shoppers. So the question started with this, is it safe to go out shopping? Yes. Now, it's also safe, if you've got a 25-year-old nephew, for him to go shopping and leave it on the doorstep. So that would be something to do, but I don't think that would be a high-risk activity. The next group are things that you can still do, but we really want you to be careful with. One would be visiting friends indoors. So, having lunch with a friend or visiting a family or whatever. Be careful about that because, again, there's a risk that one of the people in that group that's not in your household will be starting to get sick and then you'll get exposed. I think working indoors is another risk factor. We have seen so many workplace outbreaks, and typically the workplace outbreaks don't actually occur during work itself. It occurs during those times in between actually working. So when they went to the meat packing things, yes, some of it may have spread online, but most of it spread in the break room before, during lunch, and then after work. Or because when people were working with others, they said, hey, let's go to lunch. And so they had exposures there. So be careful when you work indoors. And then, restaurants are okay eating in if you're with yourself and with household members, but the more people you get, the more risk you continually add. And then you should really think twice about these high-risk activities. And these would be especially inside parties, weddings, or funerals. Inside parties, weddings, or funerals. And that's why this question in Hawaii was brought me back a little bit. Now, if that's a totally outdoor wedding in Hawaii, people are going to be distanced, certainly much safer than indoor. I would also say travel to a COVID hotspot is going to be hard. The problem is all of the airports are in COVID hotspots. So unless you're going to swim to Hawaii, you're going to have to go to Portland, you're going to be in the airport and whatever. So be careful about traveling to a COVID hotspot. The next is hugging or shaking hands with friends as a greeting. And I'm not a big hugger, but there are people who are really big huggers. And that kind of really close in-the-face activity is a problem. And then really get rid of going to work when you're even a little sick. So even going to work when you're a little bit sick, I know you want to brave it out and do it, but if that little sickness is COVID, you can spread it to others and really make your work very difficult. And then we're also asking businesses to help. We're asking business to allow employees to work from home if at all possible. Sometimes it's not possible, but in many cases it could be possible with some accommodation. So we're asking businesses to help in that way. We're asking that businesses don't pester their employees to come back before they're well. We certainly have heard that people say, well, my boss says I have to come back to work even if I'm sick, and then I expose others. Oof. And then the third is to support employees who are in quarantine. So, if you get a call from your employee, we got one today, that one of our employees was exposed and needs to stay home for 2 weeks. Well, at Doug's Public Health Network, we're going to do everything we can do that they can work at home and really be supported while they're in quarantine. And so that's what we're doing. So none of these are rules. None of these are government mandates. This is Bob asking you to do these things. We'll put this on our website. But do more of the things that will make things better. Call or video chat with somebody. Thank a nurse or nursing assistant. Shop at the business. Take care of yourself. Wear face coverings. If you can help somebody in quarantine, do it. Keep doing the good things that aren't high risk. Gatherings within your own household, walks, bike trips, car trips in the county, getting a takeout, working from home, and I think shopping at a store, if everybody's wearing a mask, is relatively low risk. But higher risk is like visiting friends indoors. Be careful about that. Be careful about working indoors with others, especially the times when you gather in between stuff. And then eating at a restaurant. Eating at a restaurant is somewhat risky. There's a lot of movement in restaurants and whatever, and you tend to be there without a mask for a long period of time. So I'm not saying you shouldn't do that, but be careful about those things. But really the things that I would be really careful about are the inside parties, weddings, or funerals. Numerous examples of huge spread. Travel to a COVID hotspot, hugging, shaking hands, those kind of things. And then going to work when you're even a little sick. And then for businesses, allow your employees to work from home if at all possible. For business to ensure that sick employees can stay home until their symptoms resolve, plus one more day. And for businesses to support employees that are in quarantine. So this is going to be Cut COVID for Kids Challenge. Sometimes in the end, somebody shaves their head or whatever. I'd shave my whole body if people would all do this. But again, let's see if we can do this, because there's 5 counties this week. On Monday, there may be 5 more counties that are kind of right on the end. So right now, the counties that are having this, what they're calling pause, Jackson just to the south, Marion to the north, Multnomah to the north, but Clackamas, Washington, Lynn are all right on the edge here. And we really don't want to get back to a point where we have to close schools and have mandatory things. Let's see if we can do this by ourselves. And so this is our Cut COVID for Kids Challenge. That was a very long answer to the question about can you go to the grocery store? And the answer is yes. Okay, let's see if there's more questions here. All right. So in the last week, there were 68 cases in 1 week. So we'll see about that. What is the start day of the school metrics? So they use what is called the Morbidity and Mortality Weekly Review Week. And you have to pick something. So what they pick is starting at 12:01 Sunday morning, going to midnight on Saturday. And that is the week. think that's great. And I think that's a great week to use. It's a week we use for every other thing: flu, salmonella, everything else, and it gives everybody in the country the same week to work on. What's happening in the past is some people pick Tuesdays, Wednesdays, Thursdays, and then it was impossible to figure out. So if you look at our Sunday this week and then go back 2 weeks, you'll get an idea of how many cases there are. Now, we count them when we get the cases. We sometimes get them before the state does, sometimes, not very often, later than they do. So the numbers may be off by 1 or 2, but pretty close. So Debbie says there's an MIT program that created an artificial intelligence that can detect COVID from the sound of a forced cough even before other symptoms appear. I did read that. So, long story, back in the 80s, I was working at Mass General in Boston. Right across the street is MIT, and we had a computer thing that tried to do that, tried to listen to coughs to go ahead and decide what the disease was. Well, this was back in the 80s, where an 086 chip, if people remember what it was there, and we could distinguish some coughs from others. So the cough of pertussis and the cough of croup are so distinctly different that you could separate them from the others. But we had a very hard time back in the 80s distinguishing the coughs of bronchitis from pneumonia and other kind of things. AI has gotten obviously a million times better than it was back in the 80s, and I think this actually is a fascinating idea. It turns out it's not predictive enough to make any decisions, but it is a very interesting thing in that machine learning is amazing, right? So when you take about, in medicine, you learn how to listen to a murmur and try and figure out what it is. For me to listen to a million murmurs would take a long time. For an AI machine, they can work all day and night listening to a million murmurs, and they can pick out what the important parts of this is. So this is exciting. It would be great if we could do it. So I'll look to see how it works out. So Andy says, is there any way there's a chance of spreading COVID through the water source? I would never say there's never a chance of anything, but we don't think so. Again, we know a fair amount about coronaviruses, right? So coronaviruses have been around for a long time. There have been 4 widely circulating coronaviruses that cause common colds. There was SARS, there was MERS, and now there's COVID. None of the others spread through water. So while it certainly is possible this one could spread through water, I think it is distinctly unlikely. All right, so what I'm going to ask is, see if you could take that challenge. So it doesn't have to be forever. It doesn't even have to be a whole month. But see if for this challenge, you could increase those things that are good things. Thanking people, helping somebody in quarantine. Keep doing the good things like walks, bike rides, car rides. Be careful about the gatherings and really think twice, really think 3 times about those high-risk activities like indoor parties, indoor weddings. That will be an issue. I was very concerned about Halloween, because on Halloween there were these big parties at several venues around the area, and we have not yet seen most of the cases that came from there, right? Because if you're exposed on Saturday, you'd just be coming up with symptoms this Friday or Saturday, and it's just halfway through Friday. So we're very worried about that. So be careful about those things. So someone says, what is the difference between a presumptive positive and what means for quarantine? Well, we think everybody who's everybody who's a positive is a positive. So positive is, and almost all of our cases now are confirmed. So well over, I think 85 or 90% of our cases are now confirmed because we're having much more easy testing. And so a confirmed case means you've got symptoms and you've got a positive test. We have almost nobody who has a positive test and no symptoms. So almost all of our confirmed cases have both symptoms and a positive test. They have a 99 point something chance of having the disease. Presumptive cases are people who are close contacts of a confirmed case, household members, otherwise close contacts, and they have two unusual symptoms: shortness of breath, loss of smell or taste, an abnormal chest x-ray, dyspnea on exertion, which means you get really short of breath when you move around, fever, and cough. You have to have two of those. I was talking with a group today, and they said, well, a lot of people have cough, a lot of people have fever. I said, okay, but how many times have you had two of those? And I don't think I've had two of those in 5 years at least. And so it's not very common to have those two of those. And we're only talking about people close contacts of a confirmed case. So you have to have two of those plus be a close contact. And if you have those, you're a case, and you should stay home for 10 days after the onset of symptoms, plus your symptoms should also be getting better. So 10 days after the onset of symptoms or your positive test, and your symptoms are mostly resolved. Now, there's a difference between quarantine and isolation. So isolation is for people who actually are cases, either presumptive or confirmed. Quarantine is for people who are contacts of cases who are not cases. In a weird twist of fate, quarantine for this disease is longer than the isolation period, which seems totally backwards, but I could explain it to you someday. All right. Looks like the questions are slowing down, but you may wake up in the middle of the night, as I did several times this week, and have a question. And you just put that in Facebook questions at douglaspublichealthnetwork.org. We'll investigate those questions beforehand and try and answer them at the very next one, which is going to be Tuesday night at 6 p.m. So we're going to do Tuesday night, 6 p.m., Friday at 4 p.m., and we'll do it. So one last question here. Oof. All right. So somebody says, what level would I have about going to Disney World with all the protocols they have in place? Well, Disney World obviously has had a tremendous contraction in their business. And because they've had a tremendous contraction in their business, they have a really, really, really vested interest in keeping people safe. And so the protocols that they have at Disney World are, they have a lot of spacing. They're not having people wait indoors. If you've ever gone to Disney World, you do that kind of little line there that you just wait for, it seems like hours indoors with hundreds of other people. They're not having people do that. They're spacing people. They're doing a lot of cleaning. And so the protocols at Disney World and Disneyland are pretty good. The problem is that you got to get there, right? So you're going to either drive down there, stay in a restaurant, and stay in a hotel, eat at a restaurant. There are going to be other people at Disney World who might share a line with you as you're waiting in line for a turkey leg or something. And that's what the risk is. So the risk is the close contact, and the risk with Disney World is it's a high-risk area. I mean, if you look at Florida, Florida has a zillion cases. I don't know what the number was, but like 6,000 cases in Florida today. So it is a high-risk area, and you will come in contact. So if I put this on the level of that, actually it was one of those things really think twice about doing. And not twice about doing forever, right? Because come next summer, when we've got a good vaccine, as I think we will, come next summer, when people have had this, come next summer, when we get better in treating and there's more monoclonal antibody out there, maybe a new antiviral drug, maybe something else along the way, then I feel much more comfortable about going to Disney World then. My kids just love Disneyland and Disney World. And so it would be great to do that. But I think what we're asking now is patience. So patience to sort of defer that satisfaction that you get to bring in your grandkids to Disney World for a little longer until we're through this. Because what I fear is that if people can't defer this gratification now and the disease now starts to spread a lot, then there truly will be interstate travel lockdowns. There truly will be closures. And I really want to avoid that. Disney's a corporation. They got to make money too. I'm not too worried about Disney. I'm really worried about our kids who aren't in school. I'm really worried about our little local businesses. And so if there does get to be a closure, yes, it'll affect Disney World, but it'll really affect our little businesses. So that's why I have the recommendations I do. You know what? These are Bob Dannenhoffer recommendations. I have no authority, but the Bob Dannenhoffer recommendations are be careful about that now and do it. I mean, my wife and I had a trip planned, a river cruise in Europe, and it was something we've been thinking about for 20 years. And we had it planned this spring, and again, the risk was just too high, and we chose not to do it. We'll do it again sometime, but not until this is well under control. So yes, I think Disney World has done a great job with the protocols, but it's still a little worrisome. And there are other places that have done well with protocols. I think the NBA did reasonably well with protocols. Spent a lot of money doing it, but they really bubbled people in there. They really avoided extra contact. I think the NFL has done a fair job, although they've certainly lost some games. I think the Pac-12 has done a pretty good job, although the Pac-12 has, I guess, has canceled the Washington game tomorrow because of cases on the team. So it can be done, but if you can defer that gratification, please go ahead and do it. A couple other things we wanted to say. Our hotline is still going. Hard to believe. We started this back on May 13th, I think, and it's still been going every single day since then. Every single day since then, one or more of our staff members has been answering calls. They have now a book of questions, which is enormous. They probably know as much about COVID as almost anyone, and they're still there every day until 5 o'clock. So if you have questions, the COVID hotline is 541-464-6550. That's 541-464-6550. Say hello to the nice people who are working there. Again, they sometimes get questions and send them to me, and that's how I know what to talk about. And in addition, they have places about where you can get testing and whatever else. In fact, while we were here, I got a question from my daughter, who I think is working on the hotline today, and she sent me a question, and I'll answer her just a bit. So again, we still have the hotline going. We're still doing our testings on Tuesdays and Fridays. The testing we're doing is the PCR testing. That's the testing which is the most uncomfortable, the most accurate, and the slowest. It's the best testing if you're going to do a pre-op. It's the best testing if you're going to travel, other than you may not get the results back in time. And it's certainly the best testing if you're an asymptomatic contact and want to know if you got it. It is not great if you're symptomatic, because it's only 2 days a week and it takes a while to get back. I think if you're symptomatic, the best testing is to go to one of the many clinics that have the Binax test and to get it there. All right, that looks like the end of the questions, and it looks like the end of the time. Here I'm getting the hook. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Thank you again for joining us. We're going to do this again on Tuesday. Hopefully by then we'll know who our next president is.